Welcome on stage, Ruth Pearce. She's a queer activist, postgraduate researcher, DJ, and plays in the trans feminist punk band Not Right. That's a perfect CV. Okay, go ahead.
Hello. I was asked to bring my guitar today, but sadly I don't have that. I just have me walking, talking, not even many pictures except this beautiful snake. And one of the interesting things about the snake is we've got this idea of the symbol of health being a staff with two snakes. That's actually the symbol of commerce. So today I'm not going with a symbol of commerce, I'm going with the single Greek snake of health. But today I'm going to be talking about trans health, and I'm going to talk a little bit about what I mean by trans, and I'm going to talk about why there are problems with trans health, specifically drawing upon research that I've been doing in the United Kingdom, which is a large-scale research project over 6 years. It's a qualitative project, so dealing with data such as people's conversations and stories, narratives rather than numbers. And I drew upon websites, I drew upon documentation from various official organizations, and I drew upon social media platforms, conversations happening in places like Facebook and Twitter. I'll also be talking a little bit about some data from a number of large European surveys to give a little bit of context. And I'm going to talk about why the internet is important, why the internet is important for trans people understanding themselves, and also why the internet is important for understanding how trans people are understanding themselves and coming to terms with maybe bridging some of the gaps that are happening between the ways that trans people understand themselves and the ways that perhaps trans people are understood differently by doctors. I'm going to begin by looking at a number of key concepts, because a lot of this is quite contested terrain. So I'm going to say what I mean and where I'm coming from for the purposes of this talk, so you can understand that. And also I realize that there might be different knowledges in the room and different people might have different understandings, so hopefully we can start in roughly the same place. And these are some fairly complex ideas, but it's something that, you know, if you lose the complexity, sometimes you lose some of the real bite from this. So what is trans? Trans is quite a new idea. The term goes back only to the late 90s when it was based upon the idea of transgender, but it's got roots that go back a long way. As a contemporary Western concept, it can be traced to anything from 19th century sexology to the gay liberation movement. But I'm looking at what's happening now. And so trans is kind of often associated with the idea of transsexualism. So a really easy example to show where I'm coming from, I will use myself. I'm a trans woman or a transsexual woman, and what that means is I was assigned a male gender at birth. Some doctors and my parents looked at me and said, hey, look, that looks like a boy. We'll bring it up as a boy, and I grew up in society in that way. And then I grew older and I was like, hey, actually it makes more sense to understand myself as a girl. And I underwent what's called transition, which is a social, but it can also be a medical process of moving physically from one gender to another. But that's not the only way to be trans. The terms transvestite and cross-dresser, and interestingly, the idea of transvestitism comes from Berlin, where it's coined by Magnus Hirschfeld. If you've ever seen that really famous picture of the Nazis burning books, that was Hirschfeld's Sexological Institute, which is a really interesting piece of history that's lost and something that was forged in Berlin. It was actually really the place where early ideas about more liberated ideas of treating trans patients first came about. But transvestite and cross-dresser are often associated with someone who, you know, is wearing different clothes, is presenting themselves, presenting their gender differently. And by presenting their gender differently, I mean the way they might, their mannerisms, all the way they dress, and the way they interact with the world. And transgender was originally coined as an umbrella term for these, and also for people who don't fit What happens if you have a transsexual who doesn't have a physical transition? What if they just transition socially? But as it turns out, this doesn't entirely describe people's experiences. And so there's language such as genderqueer or non-binary, which was coined to explain the experiences of people who are like, hey, I don't feel like my gender is either female or male. And that's gender in terms of social. There's also an idea of intersex, which is about people's bodies as they're born, but I'm not going to talk about that today. And what we've seen since is this proliferation of terms as people go, hey, I think I want to understand myself better. And these are just a few of the terms, and they're all from an Anglophone context. So if you look outside the English language, there's even more ways and there's even more complexity in ways that people can understand their gender beyond the binary of female and male, perhaps, and also in terms of ways of interacting with the gendered world. And so there's this quote I really like from Stephen Whittle in the introduction to the Transgender Studies Reader. And he says, a trans identity is now accessible almost anywhere to anyone who does not feel comfortable in the gender role they were assigned at birth. So that's opening it really wide. So we've gone from these individual identities and experiences to this overarching idea, and that's what trans is. Trans is almost an alliance. So at the same time as we're breaking down an individual experience into these really specific terms, we've got this overarching idea where people can come together and say, hey, we're all gender diverse, and perhaps we have shared interests around that. Another term that's useful to coin right now is cis. So cis, like trans, comes from a Latin root, and where trans means on the other side of, and in terms of what I'm talking about today, I would say it's on an other side of rather than the other side. There's not just two sides, not just a binary. Cis means on the same side as. So if you were assigned a female gender at birth and you're like, hey, I quite like dressing like a woman, whatever that means, and the way that you feel comfortable with that, and you're like, hey, I feel comfortable as a woman and I don't really want to change my body and I don't really want to change how I do things socially, although I might want to oppose traditional gender norms, you might be cis. So it's an antonym. It's to trans. Cis is to trans like straight or heterosexual is to gay or homosexual. So how did all this trans language happen? The answer is on the internet, which played a really important role because you've got these invisible trans communities prior to the 90s, lots of trans people who aren't immediately obvious to other trans people because we either try and pass as cis or because people are too afraid to be openly trans if they don't pass. And you've also got very small communities, sometimes in big cities, who can't connect. The internet changes that. And there's this great quote from Stephen Whittle, from the brilliantly titled The Trans-Siberian Mail Way, which I think is a great title for an academic paper. And it's really 90s, it's all like the virtual self and cyberspace. But he's still got a really important point. He says, it is the virtual self, the node of communication in cyberspace, that has allowed an actual self to be recognized. So in this way, people who might be invisible, who might be like, hey, don't look at me, I'm a bit scared, can say to each other, hey, look at who I am, declare themselves to be on the internet. And in this way, the technology of the home PC, back in the day, before mobile phones and tablets, and the internet has been a catalyst for enabling trans people to come together and build community. And this has developed, so now, of course, you've got people can talk strategically about things like health. So this quote is from a report by the EU Agency for Fundamental Rights, and a Polish psychiatrist says, in the virtual world today, patients no longer see an anonymous doctor, they research and read reviews. So trans people are talking about health, and it's gone beyond who are we, and it's going to what do we do, how do we live our lives. There's two more ideas I need to introduce right at the beginning now. One is transphobia, and transphobia is prejudice or irrational dislike or hatred or fear. It's an individual interaction between people. A transphobic interaction can be an interaction where it's like, hey, I don't like you, an act of hatred or discrimination. And in that sense, I suppose it's comparable to many ideas of sexism or homophobia. But there's also an idea called Cisgender Ism. And Cisgender Ism, if we think back to cis, it's this idea that the world is built for cis people. It's the assumption that everyone is cis or should be cis. And there's a quote from Natasha Kennedy here that I really like. And she says that cisgenderism represents a systemic erasure and problematizing of trans people by assuming that everyone is cis. An essentializing of gender as binary, biologically determined, fixed at birth, immutable, natural, and externally imposed upon the individual. So what does this have to do with health? Well, effectively, transphobia and cisgenderism are pretty common, and I'm going to look at some statistics from European Union surveys in a minute to show how that works out. But these are some quotes from my own research, and I'm not going to read through every one because there's quite a lot, and this is a tiny minority. I went and spent about 2 minutes going, okay, I'll look through some quotes, so here's loads. And the situation is, in the UK, historically, and in recent history, the National Health Service is very popular. It's very well trusted. There's a lot of faith in it. So it's a health system that inspires confidence in many ways. There's nothing I can quote off the top of my head, but there's a few surveys done on this. And if you look at NHS satisfaction, you will find quite a lot. Whereas I found that trans patients overwhelmingly did not trust that they would be treated well by their doctors. So an example of this can be found in the top quote, where a patient says, "I'm hiding my anxiety and self-harm from clinic doctors because I don't feel safe telling them about this." So why is this? One reason is that transphobia is common in health settings, discrimination, and I'll look at that in a moment. But another is that the patients can't necessarily trust the doctors to understand them and to understand what it means to be trans, to understand what their patient experience is. And I'm going to come back to that after the EU bit with a look a bit more at some of my own research examples. So looking at the European context, I've got some quotes to begin with from a 2013 piece of research, and this was a paper published on it in 2014. And it found that over half of trans people reported being discriminated or harassed against because they were trans. And the really important thing to bear in mind here is this number differs quite a lot. So the moment you look at people who are visibly trans or people who are out as trans, the number rises. If you look at particularly at-risk groups like transgender men, transgender women, as opposed to cross-dressers, actually I'm going to point out quickly here the terms are contested. You could say, well, maybe a cross-dresser can be a transgender man. So let's say a transsexual man and transsexual women. If you look at particular groups, again, the prevalence of harassment and discrimination rises. And so over 1 in 5 reported being discriminated against in health settings in the past year. So you can see this was common. This is not over a lifetime, just within the last year that experienced this. And this rose to 30% of out trans people, showing how there's an increase the moment trans people are visible. But it's not just about this level of discrimination and harassment. There's also an issue with health professionals who want to help but lack the necessary information to do so. And as you can see from a study conducted in 2008, 30% of respondents to the survey said that they encountered a health professional who wanted to help but lacked information. And so one element of that is that there's this binary idea of what gender is. And this can either be, well, you're either a man or a woman and that's the way you always are. Or it can be, well, okay, someone can be trans, maybe they can transition, but they've got to end up as a man or a woman. It's a binary idea of gender. And the 2016 Fundamental Rights Agency report on LGBT healthcare in the European Union noted that the majority of healthcare professionals, including specialists, gender specialists, appear to categorize gender or sexuality in a binary system, including assuming that trans or transgender just means transsexual, that it doesn't include genderqueer or non-binary possibilities. So in this way, we can see how it's, in some ways, a cisgenderist understanding as binary. And some other professionals who might be, okay, trans people exist, might say, well, at the same time, you know, your gender's defined at birth, so that's going to define you for the rest of your life, whatever you do. Okay, so in this way we see this isn't just about transphobia. It can be very well-meaning practitioners, but there's this cisgenderist idea which crosses culture, which affects the implementation of healthcare provision. Excuse me a moment. I've got a cold. It's the worst thing. Thank you. Feels terrible on an enormous stage. Sorry? Oh, thank you. That would be lovely. Very slick and professional. Important. This is Republica. We have to be slick and professional. It's going to be on the internet. We've got to control our digital selves, right? So one thing I particularly found out in my data was that there are these different understandings between practitioners and patients about what it means to be trans, and this is one of the key things that affected healthcare provision. So I'm going to look at 3 examples, and I've got loads. These are just 3. One is misgendering, right? And misgendering is a failure to recognize trans identities as real through not referring to a trans person with the correct gender. So I found many instances of this, and in a sense what it's saying when a trans patient sees a medical professional and they want to be perceived in a certain way, and the medical profession is like, no, you're a man, and they're like, oh, I feel terrible about this, then you have a problem whereby there's not an understanding terms. So I've got a quote here from my fieldwork diary, and I've not got the original quote from the participant because it was in a private Facebook group. But what happened is the individual said that they were gender history available to them. So in this case, the doctor was actively ignoring their gender and imposing a binary cisgenderist idea of what it means to be human upon this patient in a way that made them feel uncomfortable and you know, like, oh, maybe I shouldn't go to a hospital again, bad things will happen, I'll feel bad. So that's one example of how there's a radically different understanding of gender between doctors and patients. However, you can get problems when trans patients are recognized as trans. So trans broken arm syndrome, it's not a real medical thing. It's a term coined by trans communities in the UK. And it's best illustrated by a really bad joke, a really unfunny joke, I suppose, because it's not a very funny situation, but also is because humor is how people get through difficult problems. So I suppose if you've got 2 people and one says, doctor, doctor, I've broken my arm, and the doctor says, so tell me about your gender. No, really, I've broken my arm. No, really, tell me about your gender. And what this is it's this understanding of trans just as transition and boiling down someone's entire being to this idea that maybe they're transitioning from one gender to another. And this can influence health negatively. And so I've got examples of actual broken arms being a problem where someone's like, no, please talk about my broken arm. And a doctor's like, but I really want to know about your genital surgery. And there are reasons why you might want to do that, actually, to talk about, for instance, you might wish to ask about, okay, how's the hormone regime affecting your bone density? But there are so many examples where this is inappropriately brought up that even when there's a real reason for the doctor to ask about it, the patient doesn't trust them. So an example I've got here, and of course it doesn't just apply to broken arms, is there's a patient who has a mental health issue and they're like, please help me. And then the clinic says, no, we can't do that, I'm afraid. you're trans, that's a mental health problem, and so we'd like you to see the gender clinic about that. And the gender clinic says, well, no, we're a specialist gender clinic. We don't deal with bipolar. You're going to have to go to someone else. And this means people don't get treatment because of trans broken arm syndrome, that is, a regarding of trans just as transition. And the final example I'm going to use here is medical gatekeeping for individuals who want specialist services for physical transition. And so what we've got here is a conflict between medical expertise, medical definitions, and trans language and experience. And this is a bit more of a complicated quote because it's from Twitter, and inevitably there's the Twitter forms of convention of speaking, so you assume that everyone knows what you're talking about. So I'm just going to talk through it a little bit. So you've got a patient. She's going to a psychiatrist, and she's hoping the psychiatrist will refer her to a gender clinic, and then the gender clinic can assess her and say, you're trans or you're not trans, and she can have treatment. The gatekeeper in this instance, the psychiatrist, says, well, you're not actually a transsexual, you are a dual-role transvestite. And what this means is you like dressing as a man some of the time and a woman some of the time, and you don't need a physical intervention. And the individual says, I'm non-binary. And the psychiatrist says, well, I've got the World Health Organization International Classification of Diseases here, and that says you're either a dual-role transsexual or you're a dual-role transvestite, or you're a fetishistic transvestite, or you're a transsexual. And the person says, I'm non-binary, but please, I really need this. And then, they have to have a long argument in order to get their referral. And so we have these very rigid ideas about how treatment operates and how treatment is experienced, and also what is the basis for appropriate treatment, such as the guidance. And this comes into conflict with the individual's understanding of themselves through gatekeeping. So what do we do about this? I've got a number of suggestions. There's a lot of conversations about education within trans groups, but also particularly NGOs who are trying to help trans people. And there's this idea, yes, we'll do some education, we'll tell people about it, but often there's this kind of basic trans 101 idea, that the absolute basics, which ignores complexity and often ignores non-binary gender. And another problem with it is often it's like, I know we're going to educate everybody about the diagnostic and statistical manual of psychiatric problems, or about the international classification of diseases. So just saying trans people exist, or here's how we understand them, isn't good enough. Instead, practitioners need to recognize the diversity of trans identities and experiences. And this needs to happen in medical schools. It's just beginning to happen in the UK, but needs to happen a lot faster, as well as kind of also talking to existing practitioners. And it's not just amongst, general practitioners who might encounter trans people. Also, specialists need to take a step back and say, maybe I'm not the absolute expert on this. And whilst I've said, yes, this is complicated, sometimes it can be as simple as asking a trans patient, hey, how do you understand yourself? What are your feelings? How do you relate to ideas of gender? And also, there needs to be more conversations between policymakers and trans organizations who are absolutely willing to talk about these issues a lot of the time. And finally, I would say trans identity and experience. It's got to be recognized as this part of the real world, part of the social world. It's not just a problem someone has, it's a way someone might happen to be, and it might require medical assistance, or it might not. So this is less about, hey, we need to completely change everything, and more about, how about we talk to each other more constructively and listen to each other more constructively. So that's it, and I'd love any questions you have. Feel free to contact me on Twitter if you want to ask anything else. Thanks a lot.
Thank you very, very much. Any questions? So we have a mic here. Patricia has a mic. Yeah, please.
So is how proactive are practitioners supposed to be in terms of diagnosis when not asked? Is it different? Is it perceived as being different than if, say, someone who's binary or self-identifies as binary is talking to a practitioner? Are the boundaries different somehow?
So I think there's two ways of looking at that, and I'm going to try and keep them divided in order to have a sensible answer. On one hand, there needs to be, I think, this understanding that if a trans person comes to a doctor, they're not just there about being trans. And because it's seen as a medical problem, a lot of trans people will go and see a practitioner, and the practitioner will be, oh, they've got a medical problem, let's help them with that. And I think, as a result, trans people become defined by these medical issues, which is really inappropriate because often we'll want to go to the doctor and go, hey, I've got a really bad cold, I've been sniffling at Republica, it's been here for days. And so that's one problem. There needs to be this moving away and maybe a trusting patients to say, hey, I'd quite like to see you about a problem today and it's about me being trans. And a lot of patients, whilst it's hard for them to do that, they will usually be able to say, I want help now. As for the difference between binary and non-binary, I suppose it's an aspect of Cisgender Ism in that it's easier for binary trans people to be recognized because to a certain extent we fit within society's model of what it means to be gendered. It's like, okay, if there's only men and there's only women, well, you can have trans men and trans women as well. Whereas because non-binary isn't talked about as much, which is partly why I'm talking about it today. I'm bringing it into the public discourse. Then non-binary people become more invisible, which means if a non-binary person goes, please, I would like a referral to a gender clinic because, I'm genderqueer, and the practitioner says, what does that even mean? Which is why it's so important to have this on, for instance, medical school curricula, as well as through, kind of like activist groups talking to each other and outreach programs.
Yeah, one more question.
Hi, I'm Sarah, and I was talking earlier about sex and gender medicine, and I always have the trouble within to address the trans community because as in the medical field you have to rely on the sublying genes and how your body is of course influenced by that, as well as hormones you're also intaking by transitioning. And I'm always struggling with how to address, like saying the genes without using the binary male-female code to make it understandable to people. Can you help me on that?
I'm going to try. So I really wish I'd come to your talk, I'm afraid. It was my very brief quiet moment during the day, so I'm sorry I missed it. One of the ways forward is perhaps to gender less, but we can still talk about sex attributes. And what I mean by that is gender is this artificial set of categories. We've got male and female, and they're not entirely consistent. Okay, so women wear makeup, but sometimes men wear makeup, but women have long hair, but sometimes men are into heavy metal, so they have long hair. And so the categories are kind of artificial. Bodies also don't entirely make sense because there are a lot of people who are intersex. And so, for instance, there might be people who have an X chromosome and a Y chromosome, but they also develop female so-called secondary sexual characteristics. So one of the ways forward to this might be medical records saying, okay, here's a genital configuration. Here is a hormone regime, and here is, a chromosome regime for instances where it's relevant. And this is, it's very hard to do this because there's also instances with trans people. Often it's irrelevant, and if it's on the medical record, then someone will go, haha, this person is trans, and then treat them poorly. So it's a really difficult issue, and I think we need to have conversations around it. But in the long term, I think we need to be maybe just stepping away from gender and saying, here are the characteristics of a person.
Okay, thank you very much.
Thank you very much, and thank you for having me.
Deep insight in this very specific topic. Your flight is going in. Yeah, applause.